Adrenal insufficiency. Recognising and managing adrenal insufficiency in childcare centres and schools, teacher, staff and carer education program. Objectives. The objectives of this video are to understand that adrenal insufficiency is a serious and life-threatening medical condition if not recognised and managed correctly. To recognise the signs and symptoms of illness or injury which may lead to an emergency situation. To understand what to do in an emergency situation. To understand the importance of administering a stress dose of hydrocortisone in order to prevent progression to a possible life-threatening adrenal crisis. What teachers need to know about adrenal insufficiency. Teachers need to know the student and their normal everyday demeanour and behaviour, that students with adrenal insufficiency can participate in all routine school activities as long as the child is well and has taken their routine medications, that the student may need to take medication during school hours, usually at lunchtime between 12 and 2 p.m. Teachers also need to know that a particular student has adrenal insufficiency and what to do in an emergency. Teachers must have a raised sense of awareness about the student's potential to become unwell, that the student will require extra care and consideration if they become unwell, that staff should be aware of the emergency response plan and consult the student's health emergency letter for instructions. Know that an increased dose of oral hydrocortisone, called a stress dose, and a sweet drink are required for any illness or injury. That students should wear a medical ID tag or bracelet which should state cortisol insufficiency, give stress hydrocortisone and include parent contact details. Why the adrenal glands are so important. The adrenal glands are located on the top of the kidneys and produce the cortisol needed for the everyday functioning of the body. Cortisol is important for maintaining normal metabolism, blood pressure, blood sugar, and manages the body's reaction to stress, such as illness, injury, or trauma leading to shock. We cannot live without cortisol in the body. What is adrenal insufficiency? Adrenal insufficiency is a rare medical condition which can affect both children and adults and can be caused by different factors. For children with adrenal insufficiency, the adrenal glands fail to function properly and cannot produce enough cortisol for normal daily functioning, and most importantly, cannot secrete increased amounts needed during times of illness or injury. It is a lifelong condition, and most affected children show no signs of it unless they become sick or sustain an injury or forget to take their daily hydrocortisone tablets. Most patients with adrenal insufficiency must take replacement cortisone in the form of oral hydrocortisone tablets, known as Hysone, 2 or 3 times daily for the rest of their lives. All patients with adrenal insufficiency require extra hydrocortisone, called stress doses, when unwell or injured. Some patients also require extra salt in their diet and an extra salt-retaining tablet, Florinef. Student unwell, what to do? Immediately assess the situation. Follow standard first aid principles appropriate for the illness or injury. For example, any child with either diarrhea or vomiting would be isolated from other children. Send for help and notify parents. If safe to do so, send them to the sick bay. Refer to the child's healthcare plan, which includes the emergency letter and emergency response plan. When a student with adrenal insufficiency is unwell, they must be given a stress dose of hydrocortisone as soon as possible. This may be given orally if they are conscious and can swallow, or by injection by a paramedic or trained parent. 7. Signs to be alert for when your student is unwell. A. For minor or moderate illness, these signs and symptoms include the student feeling unwell and not seeming their usual self, tiredness, poor concentration in class, not wanting to engage with the teacher or play out in the playground, headache, nausea, abdominal pain, single vomit, or experiencing episodes of diarrhea. Other possible symptoms or complaints include sore throat, earache, coughing, sneezing, runny nose and flu-like symptoms, lethargy and fever with a temperature over 38 degrees Celsius. It is important to note that not all children will have a temperature or fever when displaying minor or moderate signs of feeling unwell. Treatment. To treat the student exhibiting signs of minor or moderate illness, an oral stress dose of hydrocortisone given with a sweet drink should be administered immediately. This should be stored and located in the first aid cupboard or sick bay in a student's emergency kit provided by the parents. If a teacher or staff member is ever in doubt about a student's condition, an ambulance should be called to take the student to hospital for assessment. B. For major illness or injury, these signs and symptoms include lethargy, sleepiness in the classroom, confusion, dizziness, unconsciousness. Significant injuries include a fracture, head injury or trauma, persistent vomiting, diarrhea, and/or looking pale or mottled. Treatment. Follow standard first aid principles. Stay with the student. Send for help and notify parents. Have an ambulance called immediately for any student exhibiting any major signs and symptoms. If the student is conscious and able to swallow, an oral stress dose of hydrocortisone should be administered with a small sweet drink or honey pending ambulance arrival. The injection of hydrocortisone should still be administered. 8. Staff responsibility. Staff need to be aware of any signs, what you observe, and symptoms, what the child may complain of, which are out of the normal character and behaviour for the child. Such signs and symptoms should prompt a teacher and staff to immediately assess and manage the situation. Instigating treatment is critical at this time to prevent the potential for an adrenal crisis, which is a medical emergency. 11. Key points to remember. Children with adrenal insufficiency look just like every child in the class. Keep parents informed if there is an illness circulating throughout the school, such as vomiting, diarrhea, and flu viruses. Adrenal crisis can happen anywhere and can progress quickly. Remember, giving a stress dose of hydrocortisone will not be harmful. Giving an injection of hydrocortisone can be life-saving. Never hesitate to call an ambulance or paramedic to give the injection. Teachers and staff should never underestimate the importance of predicting situations which may risk causing an adrenal crisis. School checklist. Know the location of the emergency letter, the emergency response plan, and what to do. Emergency medication and injection kit. Medication orders should be checked with parents for correct labelling by chemist, that the doses match medication authority for administration, and the emergency injection kit is up to date. Parents must also ensure a medical ID is worn. Excursions and school camps must have a plan with location and access to emergency services. Emergency kit must travel with the child. In summary, adrenal insufficiency is a rare and serious medical condition where illness and/or injury can lead to an adrenal crisis, a medical emergency. If ever in doubt about any situation, call an ambulance immediately and notify parents. Always refer to the student's emergency response plan. For a minor or moderate illness, give an oral stress dose of hydrocortisone, Hyzone, immediately with a sweet drink if they are conscious and able to swallow. For a major illness or injury, an injection of stress hydrocortisone, Solu-Cortef, needs to be administered by an ambulance officer or trained parent. Call an ambulance immediately. For further information, contact the child's local endocrine nurse or specialist. Further reading: Hormones and Me series, Management of Emergency or Stress Situations where Hyperglycemia of Cortisol Deficiency occur.